I'm just going to wait a few minutes here for some people to join in. Um, for those of you that are here, thank you. My name is Chris Oswald. We're going to be talking a little bit about addressing behavior change in kids and just good, effective solutions that are lifelong and lasting. This is my first time doing this, so feedback is always welcome. If you've got questions, let me know. I always like to hear them. Um, so just going to wait a few more minutes, let a couple more people join in, and then we'll be off. All right, everybody. So let's get started. Um, as I said, my name's Chris Oswald. I'm a certified nutrition specialist, certified functional medicine practitioner, and I'm a chiropractor with Metabolic Treatment Center. We've got an office in Hudson, Wisconsin. We work with all different types of people, um, many different types of problems, but one thing that we're really passionate about is people with digestive problems and myself really helping kids with figuring out behavior that's not necessarily genetically driven. You can learn more um, about us on Facebook, or you can check us out at gutsensei.com and set up any time that you may want to actually talk with us. We will do complimentary visits over the phone anytime to see if we're a good fit, see if we can help you out. So if you're not getting the answers you're looking for, just let me know and I'll see what I can do. So today, what are we going to cover? Um, how common this behavior type of problem is. This is going to include things like ADD, ADHD, obsessive compulsive, challenges with anger, um, autism. A lot of the stats are taken from autism, but the thing that most people don't realize with autism is it's a spectrum where really a lot of these symptoms of ADD, obsessive compulsive disorder, oppositional defiance disorder, they're all on that spectrum, are all aspects of pieces that we see in autism that we don't really think of as that, but it's on that spectrum. I want to help you understand why. Like, there's been a huge increase. If you have any interest in this, this is something that you've seen dramatically increase over the years. And then we're going to address like just some clear strategy, how you can go about it, some things that you can do at home, things that you might need some help with, ways to identify what the problem really is. Um, this way we can really work with you to um, help understand what you need to do, how to do it better. So that prevalence, unfortunately, you're not alone. Here's the curve. 1985, that was 5 years after I was born. 1 in 2,500. Today, 1 in 68 kids have been identified with an autism spectrum disorder. This is double since the 2000. Why is this happening? Like, that's huge. This is 4.5 times more common in boys than girls. And honestly, 1 in 6 kids, 1 in 6 in 2008 had some sort of developmental disability. This is all readily available at the CDC. These aren't stats I'm making up. This is stuff that is real, that we really need to understand what's going on. Um, Symptoms. Social problems. They just have a hard time. Your kids have a hard time making friends, playing with friends. They have a lot of social anxiety. They have a hard time, like, as soon as emotion is entered into the equation, they have a really difficult time with communication or interacting with kids or adults around them. Um, Repetitive behaviors, where they just keep asking you the same question even though you've answered it 10, 15, 20 times, or they get hyper focused on one specific thing. You can actually see this in kids who seem to be very, very prone to high athletic ability, where early on you might see like videos of like a 2-year-old who can hit a golf ball better than most adults. Well, they've been swinging that golf club for as long as they can walk, and it's just clicked for them because they've repeated that behavior. Does that mean there's a problem? No, but does it mean that, hey, maybe is there something going on that's underlying that needs to be addressed? Yeah, there could be something there. Um, this can be very counterproductive in social situations, school and sports. Digestive complaints. This is a big one that we see where people just think that they've got a bellyache or something's wrong. The gut-brain axis and the ability of the digestive system and the brain to be very closely related is well established in the literature, and most people take for granted how impactful this can be on a child's brain. And also food preferences, like if they're just wanting a certain type of food, we see a lot of kids just desiring and craving grains and things like that, then that needs to be addressed. That needs to be thought about. Like, why do they want that? There's really interesting research where it shows certain bacteria or infections in the digestive tract in animals um, that promote behavior change, where for rats, if they get something called toxoplasmosis, which is really commonly associated with like a kitty litter box, where why pregnant moms shouldn't be handling and emptying the kitty litter. Um, that's something that will actually cause these mice or rats to lose fear of the cats, where they'll run right out in front of them. Well, the way the toxoplasmosis is passed about is through cat feces. Well, the cat eats the mouse, it infects another cat, and then it passes on this bacteria. So it actually affects the mouse's brain and makes them no longer fear something that some animal they've been fearing as a natural predator for as long as they've been around. So the big question is why? A lot of times you see hyperactive kids that aren't behaving well, and it's, well, they just eat too much sugar. Well, while that does have a component in it, it's far more complex than that. Um, there's a lot of potential contributing factors. There's a lot of like why it's going on, and there's some real reasons why a child who used to be really well behaved all of a sudden just can't listen in school, won't do what they're told, and just generally are this kid that you just don't even recognize anymore. So genetics. A lot of people go back to a genetic cause. Well, when you add up all of the genetic cause of autism spectrum diseases and disorders, or things that are associated with it, it's about 21%. Only 1 in 5 causes of kids with autism spectrum disorder, like symptoms on that spectrum, are actually have a underlying genetic cause. Well, that leaves 80%, 79% of all kids that are on this. Remember that 1 in 68 kids. So of that, 79% of those kids have something that doesn't really have an identified genetic cause. We don't really know why, but there's a lot of evidence that are starting to point to some really specific causes or some predispositions to why it's there. So I love this picture. We've always got this plan, like as we're raising our kids or we go in a birth plan, how we want to feed them, how we want to read with them every night. And it seems so cut and clear, but then real life happens and reality happens. And it's a really big challenge. You know, a lot of people go out and say, like, well, just feed your kid better. Don't let them have so much sugar. Well, you know, I know very clearly what to do. And for my child, it's easier said than done. There's days where it's hard to just feed him exactly how I know he should be eating, and I know better. So certain things, the use of antibiotics in moms and kids, um, C-section, both of those introduce an infant or fetus to antibiotics right away. And this antibiotic use ultimately wipes out the microbiome that's established. And once that's wiped out, it kind of leaves this clean slate for whatever's in the environment to grow and kind of grow unchecked. We know that when this happens, when there's C-section births, when there's maternal and infant antibiotic use, the incidence of digestive problems and behavior problems both drastically increase. History of colitis, or just kind of the colicky baby, um, or if the child is eating mostly processed foods, processed or preservative rich food. Um, Food that should be eaten is food that goes bad. If it doesn't rot, you probably shouldn't eat it. Or if they're really jumpy or easily startled, that's pointing to action potentials being lowered in their brain so that a stimuli can set them off that much easier. It's just kind of pointing to a collection of points of evidence that may or may not be leading to some sort of issue. All right, so metabolic factors. This chart on the right is kind of wild. That's a biochemical chart of all, not all, that's part of the biochemistry that happens within the body. It's really, really complex. And there's so many different pieces that honestly, for one person to claim that they fully understand everything about biochemistry and how the body interacts with it, I would not believe them at all, because to really know how each of these pieces of this hugely complex chart interact with everything else in the body is pretty close to impossible. I'm sure everything's possible, but I only hope to very deeply understand small pieces of this chart, and with that understanding, I have confidence that can make really big changes for the right person. So some of those factors that are in that 80%, mitochondrial disorders, like real mitochondrial disease, and electron transport chain overactivity. It's just not working right. It's overstimulated. Acetylcarnitine or fatty acid oxidation abnormalities. Um, Mitochondria themselves are very, very hard to test for. So when you're looking at it, really the only way is to test for byproducts and levels of vitamins or nutrients or molecules that are increased when you see high mitochondrial turnover. Um, and the electron transport chain is what's responsible for creating a lot of the intracellular energy. And fatty acids are, it's important for the body to take fatty acids and put them into, be able to move them into the mitochondria to be able to use as precursor fuel, to oxidize them and be able to pull energy, ATP, that currency of energy out and utilize them. Oxidative stress. So things like when you're run out of glutathione, which is the primary intracellular antioxidant, or decreased enzyme function, where you have enough glutathione, but there's not enough of certain enzymes to get it into the form that it needs to be, or increased oxidized molecules. There's also folate abnormalities. So there's actual autoantibodies to a folate receptor in the brain. Research is showing that this is up, way up in kids that are on the autism spectrum disorder. Or mitochondrial based folate receptors. So actually in the mitochondria, folic acid isn't being responded to appropriately. So those mitochondrial disorders, it's the powerhouse of the cell, powerhouse of very highly metabolic tissues. So the brain, immune tissues, digestive tissues, and impaired energetics of the cell results with that reduced ability to utilize fatty acids for fuel. It's, like I said earlier, very, very difficult to have a direct test for that function, for the overall function. And really, this is what you're looking at. You're looking at that Krebs cycle. It's a really important cycle which runs within the mitochondria and ultimately ATP. So let's see where I can find my cursor. Right here, that ATP is something that we need to be producing. And when it's not right, you can actually have blocks in certain areas. This is one big one where it gets blocked up right here because the increased amount of something called propionic acid, which is the result of when you're taking in too many of primarily like the grain-based carbohydrates, it increases that. So, and that propionic acid, interestingly enough, so here we'll take a little bit of a jaunt off to the side here. And one of the primary interventions for kids with ADHD is stimulant medication. Ritalin, Adderall, there are some others now. But that medication actually interacts with the same receptors as propionic acid does. So when propionic acid is up, it's going to interact with those receptors and cause certain things to happen for behavior. Then what's being part of what could potentially be done in the brain when they're taking these stimulant types of medications that definitely they work. They increase focus a lot. It's probably blocking the action of the propionic acid within the brain. So part of the important piece of when we start later talk about how to actually address this and solutions and good strategies for improving a child's health, there's real underpinnings to why. It's not just, I'll eat less of that because it's supposed to help. This is why. And for me, a lot of times when people understand the why, that's when you really are willing to make that change and you know the goals and what to do and how to move forward. So we're going to look at a little bit of research here. I promise it's not going to be too much. So in the journal Molecular Psychiatry, 2012, mitochondrial dysfunction in autism spectrum disorders is a systemic review. So the systematic review looks at tons and tons of past research and just kind of examines it and what's going on. Really what it said when it came down to it. Kids with mitochondrial disease that are on the autism spectrum disorder have more medical abnormalities than the idiopathic autism spectrum disorder children. So things you see a lot more things like seizures and motor delay, GI abnormalities, a lot of that stuff. So let's go to this next slide. Same journal. So what it's looking at is there's a huge discrepancy between diagnosed mitochondrial disease and the prevalence of biomarkers of mitochondrial disease. So you see some of these biomarkers, elevated lactate, elevated pyruvate, the ratio of lactate to pyruvate, elevated alanine, low total carnitine. All of those biomarkers point to the mitochondria not working as well. Does it point to the fact that kids have mitochondrial disease? No, but it points out to a functional decline. And that functional decline of the mitochondria many times can be the cause. Because remember how we said that they're really important for the energetics in the brain? Well, when they're not working well in the brain's not getting enough energy, and guess what? The way the brain is going to tell someone to operate in life is not going to be appropriate. It's not going to be the way that things were intended. So oxidative stress. Oxidative stress is a huge insult to mitochondria. These increased free radicals interact with different tissues and damage cells throughout the body. Lots of different sources, chemical exposure, so cleaning supplies, things called phthalates, chemicals in plastic, chemicals in the air, water, food, deep fried foods, being dehydrated, not drinking enough water. Most kids don't drink enough water. They're drinking pop or things along those lines. They need to drink more water. High sugar intake can do that. I said it's not all sugar, but sugar's a part. Sugar's important. Microbial imbalances, remember? Microbial imbalance in the digestive tract. When that gets off, well, you know what? It needs to be balanced because it's harming the entire system. Food preservatives, artificial colors and flavorings, and stress. I read some research not long ago that kids today have more stress than their parents. I want to repeat that. Today's kids are more stressed out than their parents are. Just imagine how you may feel with everything that's coming down on you, everything that you have to do, how much stress you feel that you have, and your kids have more. Just take a step back and think about that for a while. The next time one of your children is having a tough time and you're stressed, they're just as stressed as you are. So if we look at this chart here, we look at this chronic, ROS is reactive oxidative species, so chronic oxidative stress. Also reduced glutathione, which is the primary intracellular antioxidant. a normal response. You have the small proton leak, and then this decoupling, this UC2 protein, it's an uncoupling protein. There's this small increase because it's decoupling in the mitochondria. So the mitochondria aren't working as well. But you have a reserve capacity. So that reserve capacity, you burn through just a little bit. So that's a normal response. Then you have this mild, acute oxidative insult. So huge ATP demand. Like you need a lot to like fix the problem. So you turn it over, bigger proton leak, and you burn through your proton capacity or your reserve capacity even more. And then you have a really severe oxidative insult, cell death. You damage the electron transport chain. What makes most of your cellular energy? Membranes are damaged and you burn through all of your reserve. How many people feel like they've burned through their reserve? It's really common. We see it a lot in adults. We're starting to unfortunately see it more in kids. And when you run out of energy for your cells, that's a tough place to be. If we look at this maladaptive response, when the mitochondria have other problems, you immediately see this huge amount of uncoupling. When it uncouples, it's not going to work appropriately. You burn through a ton of ATP, and then you get into this high ATP demand with tons of turnover, a huge amount of proton leak, and you burn through that reserve capacity very, very rapidly. Oxidative stress isn't something to mess with. Antioxidants are important, but it's all about balance. And it's all about understanding when it's appropriate to really address oxidative stress. So then folate abnormalities. So remember I said that in the brain, that folate receptor autoantibodies, you see it up a ton. It's something that's a problem. It's something that just taking a small amount of folate to help these kids overcome those autoantibodies to fill up the receptors that need that. It's absolutely wild, the impact on their life and how much better they get when saving thousands and thousands of dollars. I saw some research where they looked at the speech. Let me see if I can actually pull it up here real quick. Let's see here. So, all right, so here's just a piece of research, going to bring this over here. So you see the overall treatment response, folinic acid, you see a baseline, and at 12 weeks, the verbal communication, the score. Look at the big difference, and that's in speech therapy. Then we go here, and then you look at this. Look at the cost. The amount of time, the amount of effort that you can have and what you can address and improve when you're starting to use some supplements strategically, excuse me, in the treatment and addressing of a lot of these potential underlying problems that are there. So now this is where the importance is. We talked about, excuse me, just need a little bit of water there. So we talked about how much this is increasing. We talked about a little bit of the underlying why. There's a ton more why, but honestly, that's for me to know, for you to understand that there is a reason why things have changed, why you really need to just kind of work on things and address things. So let's dig in a little bit, what we can do. So the most important thing, we need to identify the root cause. So there's lab testing. That's more functionally oriented. When you don't have a genetic cause, when you don't have mitochondrial disease, then it's like, okay, what next? Like, what do we do? Doc says my child is fine, but I know that something's wrong with my kid. So lab testing. This OAT test, it's called an organic acids test. Remember the Krebs cycle? The one that produces ATP in the mitochondria, you can actually do a urinalysis and it tells us how well that's working. It really lets us know, okay, these specific nutrients are needed in higher doses to help support the enzymatic processes. A lot of times it's functional decline or genetic individuality where a child just needs higher levels of certain nutrients to run the process as well as their friends do. Stool testing. We can look at stool testing to really understand the balance of bacteria. So one specific species, it's called Clostridia. When Clostridia is up, it's going to tell your child, where I said earlier, talking about the cat and the mice getting toxoplasmosis and mice losing their fear of the cat. Well, in kids, if they get high levels of Clostridia, all of a sudden they start to get cravings. All they want is bread. They ask for bread every night. They could eat a loaf of bread. They eat cereal for breakfast. They eat peanut butter and jelly sandwich for lunch. And they have a whole bunch of pasta with bread for dinner every single day. Well, you know what? That's not your child asking for it. That's the bacteria in their gut asking for it. And then what that bacteria is giving off high levels of is that propionic acid. And when you have that high levels of propionic acid, it's called a short chain fatty acid, really important for energetics in the brain. There's another one called butyric acid, which is really important in the brain. Well, you want more butyric acid than propionic acid. When that ratio shifts, you got a problem. So there's good strategies in helping to balance that out and get that to work better. We can look at blood testing, how I mentioned a lot of those biomarkers of mitochondrial function. We can look at that in the blood. We can look for potential infections and antibodies to digestive infections in the blood. Then we can look at a fatty acid analysis where we can actually see, does your child have a fatty acid imbalance, which is promoting further imbalance in cell membrane dysfunction elsewhere throughout the body. Then there's also going to be like some of this research really points towards impaired carbohydrate metabolism. All right, I've got a dog that needs to go outside. Just hang on just 1 second. All right, I'm back. So really what these two pieces of research are showing is that carbohydrate digestion is impaired. And you see in kids with autism and GI disturbances, you're seeing this high levels of Clostridia. Uh, and you're seeing this Clostridia in the wrong places throughout the body where you don't want that. Um, and then you're also looking at some of these biomarkers of the abnormal energy metabolism. And there's clear data that shows when you're seeing some of these things up or down when they should be higher, uh, that it's pointing to this energy metabolism problem, which is pointing to the mitochondria not being able to provide enough energy for your child's brain to be able to respond appropriately to certain social situations or when things are being asked of them. Um, all right. So, and that looks at those biomarkers once again. Um, so, like once you have a strategy, once you have identified a problem, then you need to organize things. So we've got all this data now. You've done all these tests. You've got all this data. So, a couple things. Keep it simple. So many people try to overcomplicate things, and you really need to work foundationally. Start from the foundation and build up from there and get more specific. And only try one or two changes at a time. If you do too much, you're going to fail. I promise you, change is really hard. When it becomes a habit, add another one, and on and on. You really want to identify your goals. You want to know, what are you looking for? Why are you working? When people come to see me, two questions we ask. What are your goals? What do you want to achieve working with us? And what would you be minimally satisfied with? Because a lot of times there's this perfect world. I want this to happen. But there's also, if I got to this point, I'd be really happy. You need to understand that because you need to know like where you are. If things have been tough, you get to a point and you might not be getting any better than that. And that's unfortunate, but you need to know where you'll be minimally satisfied. And then you also need to understand the outcomes that are within that are most valuable to you because you might be able to achieve certain pieces of your goal or certain pieces of what you'd be minimally satisfied with that are of higher priority than others, and you just might need to focus on them. So, first, you need to have a plan of action. What are the goals and outcomes? We just talked about that. It gives us a focus of care. It helps us to understand what supplements, if any, what exercise or activity, um, any medications. I don't have a license to prescribe medication, but sometimes medication is necessary. Should it be used forever? In my opinion, where I don't have the right to prescribe, if you support healthy function and there's no genetic problems or mitochondrial disease or underlying pathologies, long-term medication use shouldn't have to be used. You should also understand the amount of follow-up care. Is it one visit and you just get the plan and then you're on your own? Is it once a week? Is it once a month? Is it every 6 months? Is it as you need over the course of 6 months where you just kind of have access to someone who knows very much what they're doing, and you get that access and you just reach out and they help you out. There's a lot of different ways that this can be done. Are you provided resources? Online resources. There's tons of online resources. The challenge is sorting through what's good, what isn't good. Um, the online community, because a lot of times there's support groups, there's other parents that you can interact with that have gone through a similar type of path who um, are attempting to make the same types of changes, and sometimes you can talk about what works for them, what doesn't work for them. Other practitioners, a lot of times it's a team. We work with a team of doctors, a team of practitioners with many of our patients, trying to identify what we all can do individually to work together to have the outcome that we all want. Uh, Symptoms to monitor. What do you need to watch? Like, do you need to watch behavior? Like, what's important to monitor? All of those are really, really big. So this is an example of a action plan of what we like to provide to our patients, give them all the resources, how to contact us, what they're going to do, and this is just the overview. They get lots of individual pieces. One of the things that we really like to monitor is sleep quality, energy quality, overall mood, and pain levels or the primary symptoms. So if it's pain, we monitor pain. If it's behavior or um, notes home from school, we monitor that. So it all depends on what the specifics are, but there's three general: sleep, energy, and mood. And when sleep is good, and energy is good, and mood is good, I'm willing to bet that there's going to be less behavior problems, there's going to be less pain, there's going to be less digestive problems. All of that is going to probably be better. So this is something that we developed in our practice. We call it a goals and satisfaction index. So what we do is we figure out your goals, and we want to make sure that we look at where you are right now in intensity, frequency, and duration. Then we want to identify the goal. What do you want it to be? So let's say you are getting 10 notes home per week. That's 10 out of 10. And your goal is to have 0, but you'd be minimally satisfied with 3. So it just kind of helps to um, put that all in perspective for you and to really help it be what you need it to be. Um, so then we need to move on. We have the idea. We've got your plan. We know what we're going to do and how we're going to address things. We need to start to implement the plan, and we need to assess as things go because Implementation requires a lot of tracking. We need to know what's going on. We need to implement the solutions based on priority in your personal goals. It's not what I want for you, it's what you want for you and what we've agreed is best for you. And we also, the assessment is ongoing. We do something called treatment-based assessment. And in this treatment-based assessment, we're always monitoring and always looking to see, okay, how did you respond to something? Because sometimes people get better and they're just better. Sometimes people get worse. That gives us information. Sometimes people get better for just a little bit, then get worse again. Sometimes people only get a little bit better. All of that provides us information on how to adjust the current treatment plan to be tailored to what you need. So treatment tracking. You need to monitor and document your responses to your treatment and being very specific. And with just implementing one treatment at a time, if you try to do too much at one given time, it's going to be a problem. You're not going to know what works. Things might be counteracting each other. You need to do one thing at a time. And here's an example. This is an overall tracker. We do have trackers that look at one specific treatment. And really, this is just looking at some of those overall big symptoms that we talked about: sleep, energy, mood, and pain. And every week you check in. This is over the course of 6 months. We really like to work with people kind of as needed over the course of 6 months because it takes time to fix things. And then you track it. And then it's really easy to look at it. With our chart that we have and we give people, it actually builds a nice little graph so you can see things go up and down and get better or get worse. And it's kind of fun to watch people get better and look at that graph. Something called treatment-based assessment. So understanding your response provides unbelievable information. You really need to understand what works for you. Not me, not your friend, not other patient that I worked with that I thought was exactly the same as you, what works for you. And you really get to see the direction, so the vector. Is it a good response or is it a bad response? And then the magnitude, is it a little response or a big response? So when we look and we get up here, this is a positive response in a very large magnitude. So the biggest response we can hope for. But you know what? A little bit of treatment helps. Sometimes it does nothing. Sometimes you get worse. Each individual box here gives us great information for what you need, the direction you need to go, what can be done to help you get that much better. So you want to keep your goals in mind. Ensure your treatment objectives, yours, not mine, not whoever you're working with, your treatment objectives always stay in line with your goals and values. So then we move on to the execution of the plan. So you want to do things that are lifelong solutions. If it's just a flash in the pan, you better understand it and it better be told like this is a temporary thing. And it might be more difficult to do, but anything that you're asked to do for a long time should be easy to implement over the long term within your life. There's dietary interventions, there's supplemental interventions, there are activity interventions, mindset. This collection of 5 different things has wonderful effect for a child who's having challenges with behavior. Honestly, this is a general framework that we use for most of our patients. There's always changes, but it works really, really well. So for lifelong solutions, treatment should fit into 2 categories. Very short term, and sometimes this can only be a couple weeks, sometimes 3 to 6 months, it kind of depends. That's medications, pharmaceutical, or nutraceutical supplements. But the sustainable long-term things, food, which is always foundational. If you're not willing to modify your diet towards a more healthy and productive diet for what your body needs, anything else doesn't really matter. Activity, and then mindset. You really need to shift a mindset. And there's a lot of different ways to do that. There's some specific things on mindset that have been shown to be really, really good with behavior in kids. So the therapeutic diet that we really like for kids with behavior types of problems, what we want you to eat more of. Fermented foods, so sauerkraut, kimchi, pickles, honestly anything fermented and real. Whole grains, not a lot, like minimal, but if you're gonna eat grains, I want you to eat them as close to nature as found, not the refined grains. vegetables, brightly colored foods, lean meats, um, fish, eggs, the whole egg, like the whole thing. And when we're talking about food, it's always the highest quality that you're able to do. Organic, free range, um, grass fed. That's always what we like, but we know it's not always realistic. So the best you can do. Uh, and then prebiotic foods, fiber, inulin is a big one. Which we can talk about supplementally, but you can get it in food too. So Jerusalem artichokes specifically, garlic, onions, leeks, asparagus, um, cocoa. So you get to have you can have some things that taste good too. Flaxseed, grind it up though. Um, always remember to grind it up. Bananas, apples, fruits like that. Things you want to eat less of refined carbohydrates. So cut out the white breads, white pastas, high fructose corn syrup. There's so many things in there that are not good for kids, and it's on the first ingredient on the label so often for kids. Really needs to be something that's addressed. Uh, Food additives and preservatives. Calcium propionate. Remember when we talked about propionic acid being produced as a short chain fatty acid in um, from certain types of bacteria. Well, this calcium propionate is in a lot of those same foods that the Clostridium bacteria likes to break down in order to make propionic acid. Um, the refined grains is a big source. Identify food sensitivities. Sometimes there are problems, like where somebody just doesn't do well. They don't have an allergy to the food, but they just don't do as well. So it's something that you need to identify, correct, and just remove it from the diet. It might get better with time, but definitely I wouldn't bring it back until you've really achieved your goals and know how good your child can be. Then you can bring it back. And if you notice a slide in behavior, you realize, well, this is something that's just unfortunately not an option. Um, Supplemental nutrition, so supplements, prebiotics, inulin, beta glucan. Excellent options. It feeds the good bacteria, promotes their health. It's great. Omega 3s, DHA helps the brain's healthy development. EPA decreases brain inflammation. Um, Carnitine, something that supports the ability of the fatty acid oxidation. It pulls the fatty acids and brings them into the mitochondria and brain. So it also supports the neuronal health in the brain. And NAC, glutathione, which is a very potent antioxidant. NAC is a glutathione precursor, which helps with that antioxidant need in terms of when there's high levels of oxidative stress. This is from the British Medical Journal on Pediatrics um, in 2011. And basically what it says is on placebo or with supplemental nutrient, and I think it was just a multivitamin, so bringing just some extra nutrients, it showed the impression of parents. So placebo across the board was worse than when there's supplemental nutrition in the kids' diets. So to me, that's pretty powerful, generalized evidence to support, hey, if my kid is having some trouble, picking out the right nutrients to provide them can have a very, potentially very potent effect on their outward behavior that you'll be able to see and experience as a parent. Activity. Exercise, there's great evidence that shows it improves social behavior, motor skills, neuropsychological parameters, just how well they do in school. Get your kids to move more. What the research says is not really any specific activity, it's just getting them to breathe hard. I really like 30 to 60 minutes a day, some sort of level of activity that gets them breathing heavy. Mindset. You know, in kids, meditation kind of sounds weird. For a lot of adults, meditation sounds kind of weird. Um, but there's a couple guided meditations that work really well with kids, and there's some evidence that it's being used in schools, and the results are absolutely wild. If you just Google um, detention and meditation, you'll see that in the last couple months, there's been a lot of stories in Newsweek, Huffington Post, the big outlets that are following this, and um, coming out with some pretty um, potent evidence and pretty compelling evidence to show that this has an effect on behavior. So a couple different guided meditations you could try with your kids, where you sit, you just have them close their eyes, relax, sit nicely on the floor, tell them to imagine their belly, take a breath in, imagine their belly filling up like a balloon, and then let all of the air out, and nice and slow, and then again. And just have them imagine that as they take deep breaths in and deep breaths out. Then you can play something called Follow the Leader, where you have your children imagine that their mind is the follower and their breath is the leader. And their mind just thinks about their breath and kind of follows it. So when they breathe in, they're thinking about it. And when they breathe out, they're thinking about it. Um, there's also another guided relaxation where you just have the kids relax, take deep breaths in and out. And with each breath in, they imagine that all of that breath that they're taking in and all of that air that they're taking in is going to their right foot, then their left foot, then their right ankle, then the left, and really just working up through the body and just kind of very calmly talking them through, having them focus on the different parts of their body, and then slowly bringing them back to being more focused on their current consciousness. So here's a couple of those stories that I had referenced. So you've got in Minnesota, I'm from Minnesota, um, they're using mindful meditation and having excellent results. The story in CNN, which has been in the news a lot as lately, um, they're instead of detention, they're sending kids to meditation, and they're having them meditate, and they're blown away by the results. If you just Google detention and meditation, read some of the stories, watch some of the videos, it's wild. It's so cool to see um, how huge the impact is and what a huge change just one seemingly simple and not connected intervention can have for people. Um, you know, I want to thank you for your time. Really appreciate everything that all the time that you've given me. I know that you're busy. I'm here so you can get to see me a little bit better. Don't generally like to be the focus of attention for this. Um, but you can learn more about us at gutsensei.com. It's our website. We offer 100% free, no obligation consultation to see if we're a good fit, to see if we're what you're looking for. If you just kind of want to follow and see when I do some more of things like this or share little tips and helpful pointers, I really like to be of great value. That's what's important to me, that I can be of a value to you. You can stay in touch. Follow me, facebook.com/Dr. Chris Oswald, or if you just search for me, you'll see my face there. And you can just like the page and follow things and see what I'm putting out there. Always looking for some new great research to share and see what it can mean for you and your family. So wishing you a happy holidays and a very welcome new year to 2017. And if you have any questions, please comment on this video, send me a message on Facebook, contact us through, and there's my little guy back there. Um, Contact us through, can you wave, Landon? Oh, wave over here. They can't see you. Yeah, there you go. All right. Um, and just reach out. We want to help. Do anything we can. All right. Thank you, and you have yourself a great rest of the day and week.